Looks like we have some more people funneling in, so we'll go ahead and kick it off. Welcome, everyone, and thank you for joining us today. My name is Nick Horseman. I manage our partners and alliances here at IriusRisk. I'll be moderating today's webinar. We will be discussing doctor's orders, navigating secure design when AI is the antidote, focused in the healthcare space today. And we've got some amazing speakers. We've got Robert Wood, one of our partners, founder of SideKick Security. Also got Brandon Green, Senior Solution Architect and Threat Modeling Expert from IriusRisk. Just a few housekeeping items before I pass it over to Brandon and Robert. If you have any questions during the session today, please utilize the chat box and we'll get to as many of those as possible. We'll also have a recording published of today's session. There's going to be some links shared. We will post those in the chat and make sure you get those. And then we'll also have a follow-up email going out after this. So with that, let's go ahead and begin. I'll pass it over to Robert and Brandon and we can get started.
Yeah, thanks, Nick. Appreciate it. This is it's a really exciting topic and one that I'm finding a lot of organizations and individuals just really don't know where to start. As we all know, AI evolves rapidly, and that's one of the main challenges, right? We're not just trying to secure static infrastructure. We're securing dynamically changing parameters. So I'm looking forward to this conversation. Robert, any initial thoughts before we jump into the meat of it?
I am also really keen on this topic. My background's in AppSec, and one of the things that's always struck me about AppSec is it is one of those disciplines in security that seems to lack the deterministic, if this then that sort of clear answers that a lot of stuff in security has. It's just not a solid characteristic. Like, obviously there's good practices, there's best practices, a lot of work that goes out around that, but there's all of these just really subtle ways that things end up breaking in the software world, and I feel like AI is dropped a little hand grenade in the middle of all that and just made it even more complicated, which is but also like tremendous opportunity. So it's a super cool topic. So
So this is a really interesting stat. I'll read it out loud. It's okay. Sorry with you, Nick. So 63% of healthcare security teams report feeling underprepared to tackle AI-specific threats in their compliance frameworks. This is such an important point to keep in mind. Obviously, as cybersecurity professionals, we want to know what we know or need to know to do our job. Obviously, raising your hand and say, hey, I don't know anything about this AI thing as it relates to my healthcare system. Very rarely do you find individuals that I've worked with that'll, kind of openly raise their hand and admit that, especially to their bosses. But this is the reality that a lot of people face. They don't know where to start. They don't know the dynamic nature of artificial intelligence. And I mean, not to mention that the regulatory frameworks or requirements for anything related to healthcare, doing anything with patient data, is just through the roof and hyper restrictive. So, I empathize with this a lot because at some point we all didn't know anything about anything. And so as we continue to ramp up, I think it's really important that we have a level of empathy for not only our coworkers, but our managers as well. These people who need the thing implemented yesterday, regardless of our 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 reservations about maybe doing it right and not fast. But this statistic hits home pretty heavily for me because I was once one of the unprepared. So what are you seeing, Robert, as far as the skill sets that people are either lacking or needing more of?
and I'm on mute. So I feel like there's I don't know that anyone can really be like fully prepared for this stuff. Like, there's it's funny, you kind of scroll LinkedIn or whatever, YouTube, however you're kind of consuming information, or like updates from your kind of circles. And there's a lot of folks who are spending time and investing and developing in being users of AI tools and getting really creative with like, prompt engineering and
Yeah.
so I really struggle to call that engineering, but the like prompt development and setup and like stitching these tools together and like
Mhm.
you've got really awesome frameworks like N8N and make that are like allowing people to do all these just really cool things. But uh it's like where do you draw the line on what's like expert or
Yeah.
prepared? Because
It's very subjective.
yeah, it's very subjective, and it's also like being able to use something does not necessarily make you qualified
Exactly.
to like understand its innards.
Exactly.
Like I can drive a Porsche 911. I don't think I could rebuild its engine.
Yeah.
Uh, but I'll drive the hell out of it and have a lot of fun. Um, and like I would not know what I'm doing if I was to like have to tweak something or like mod something or whatever. And in this like if you think about like the threat model of AI in this regulated context, you have kind of those like tip of the iceberg type of attacks, and I think there's a lot of them that are more user land stuff, and then
Mhm.
you've got a whole host of much more subtle things, just like in the rest of the software world, and it's all those like more subtle things that like are not made clear by anything you might do on the user front. And like using one of these like DLP for AI kind of tools is not like that's not going to cut it. It like you really, I think, need to be consuming information and trying to learn to the extent that you can, or bring it
Yeah.
like surrounding yourself with people who are really experts on those like those innards of, how some of these like protocols like MCP and such are
Mhm.
built and used and applied and folks who are like really building things, not just using things and
Using
stitching
it.
them together.
Yeah.
It's like, if it's like if you were to compare somebody who's built like a bunch of low no code apps
Hmm.
for a business and like somebody who's built like true software or like enterprise software or like an old neckbeard like kernel engineer,
Yeah.
like they might have both built stuff, but one of these is not like the other.
Yeah.
And I feel like the especially with the stakes being so high in a regulated space and like healthcare, you've got OCR and HIPAA pressures and whatnot. That's a very real thing that if you experience a breach and it's due to some sort of negligence or whatever,
Hmm.
there's fines. You get on like the HIPAA wall of shame. You get on the you might have pressures blowing back from your kind of supply chain, business associates, covered entities, etc. Like there's real bottom line reputational and kind of material impacts if something goes wrong. And so I definitely appreciate the concern that somebody would be feeling when it like if they're faced with this new set of things, they don't understand the like the innards of it, and they have all of this kind of looming pressure of what could happen if something goes wrong. But at the same time, you've got all this looming pressure and surging pressure of like, hey, we want, we got to adopt this stuff. It's coming, it's here, it's got to happen now. Like, and those things just like all of that doesn't fit together
Yeah.
super nicely. And like you could go like build an AI governance policy and call yourself compliant, but like that really doesn't like anyone who's actually tried to like build a security program in a large organization will quickly tell you that having a policy and getting people to actually follow the policy and getting
Mhm.
resources to apply the policy and all of those things are not the same thing.
Yeah. Yeah, I've slid into the DMs of a few CISOs over the last year, kind of just asking how they're finding, implementing AI and, some of the challenges that they're finding ramping it up inside of the organization. And a lot of CISOs that I've talked to, they say they have, they'll get a directive made potentially from like the board or something. Hey, we need this thing yesterday. Our competitors have it, whatever the case may be, make it happen. Obviously, and to your point, Robert, that doesn't mesh well with the security aspect of it, which should not be fast, right? Regardless of how many of your competitors are using it, you need to deploy it right. And they're finding a lot of challenges with kind of making the powers that be slow down a little bit and actually, test these things out and train them properly and make sure that, there's no bias and things like that. So it's interesting to hear you say that not only from a end user perspective, but the same challenges exist at the C level as well. So really good point.
Yeah. Well, so I want to contest one thing maybe ever so slightly,
Yeah.
because the the whole idea of like, doing it right as opposed to doing it fast, like generally speaking, I agree. But
Mhm.
I do think it's like in the space that we operate in security, privacy, compliance, we oftentimes kind of absolve ourselves of the the opportunity cost that it takes to do security and to do it right.
Mhm.
And I mean, so I worked at three different startups, like tech startups, before I went into running security at Medicare and Medicaid services. And in all of those cases, like you're in a hot market that's moving quickly. Your competitors are, there's stuff happening around you. And if you do delay and drag your feet, then, they're like you may lose uh, some kind of momentum or some kind of like opportunity
Mhm.
in the market and growth side of the organization that is really hard to recover from. And
Sure.
that there's risk in that too.
Yeah.
And that it kind of leaves the pressure all on the or maybe not all, but in a non-trivial part on the shoulders of the security teams and the compliance teams, like make sure that this is done like right or done right enough.
Mhm. Yeah.
And that you're like building the plane as you fly it. And that um when there's threats nowadays of, being personally liable for security programs gone wrong and stuff like that, it's a non-trivial amount of like anxiety just hanging over your head. So
Yeah.
that statistic is just it really jumps out and resonates with me because of those kind of dynamics.
Mhm.
Yeah.
Did we
So
already have a question yet in the chat? I don't think so. Not yet.
Let me
Oh,
check.
oh,
Nothing coming in yet, guys. If you have any questions, feel free to put them in the
okay.
chat and we can get to them. I was thinking of one, just how you guys would you wrap security around AI being so new? Like, what are some best practices or thoughts around if your team says, hey, we want to implement, this new AI feature in our platform? What would be some best practices they could do to make sure that was secure?
Yeah. So, I mean, you all right if I take the first stab at it, Robert?
go for it.
Cool. So yeah, obviously, step one, a little biased here, but step one should probably be threat modeling that new feature, that new addition to your system, right? Mapping out the access points. Are there any data being transmitted to and from it? Making sure that those are encrypted at rest. I mean, we're talking about healthcare here, so anything to do with patient data needs to be encrypted and protected at all costs. So I think threat modeling, that initial feature, hey, I want to make this API call to Chat GPT for whatever reason. You need to make sure that that those endpoints are secure. Don't allow special characters in API reference IDs, et cetera. Kind of low level stuff. But step one, threat model it. What can go wrong? Like, what are you actually adding, right? What can go wrong? Your threats, and then what are you going to do about it? Your controls, your countermeasures. So I think that's a good first step. Step one is threat model the thing you're thinking about building or adding on.
Yeah, I like, and this is my digital bias, definitely coming through, but I like the threat modeling answer to a lot of this, this change. I do think too, though, and this is definitely not my digital bias coming through, but I think there is value in kind of bringing it back to compliance, bringing it back to policy, and having, like, policy is not going to cover all the things that could go wrong and all that kind of stuff. But I think it serve, like, policy and compliance and the regulation you have to abide by serve as a useful North Star, if you will, on the things that you need to make sure, like, either definitely happen or definitely don't happen. And then all that other stuff, that squishy in the middle stuff, is where your threat modeling and your ideation and brainstorming can really come into play. And I think if you're at that stage where you're early enough where you can sit down and have those threat modeling conversations. And I don't think it has to be like a big, like at Sigil, we used to do, the big kind of formalized architecture risk analysis type of engagements where you're really like teasing out all the different interactions and components and trust
Yeah.
boundaries and whatnot of a system. I don't think it has to be that detailed. I think the questions that you just laid out, like the show stack questions,
Mhm.
uh, those four guiding, prompting questions. I mean, hell, like, use ChatGPT to answer it, to threat model itself, and, like, get some ideas. And if you're coming up blank, and the I think you will cover a lot of the, like, security requirements that your team needs to at least be thinking about when it comes to building these things, or at least, like, it'll serve as a good, like, conversation starter.
Yeah.
And you're kind of engaging in the conversation and thinking through what could go wrong, thinking through what, where you need to kind of shore up controls or segment data or use test data some way, whatever the activities are, like, um you're going to figure that out together, as opposed to security like chucking stuff over the fence to
Right.
the engineering teams or the product
Yeah.
teams, whoever's doing it. um so yeah, I think starting with a grounding in policy, compliance, regulation, and then drawing yourself into threat modeling is a good thing. I would also say, like, if you happen to find yourself in a situation where you're further along, where something happened and you didn't get to be at that first stage,
Mhm.
there, I could certainly see threat modeling, I think, could still help, even though you don't get to, like, shape things proactively.
Mhm.
But you may get a little bit more wow factor with something more like a targeted pen test,
Mhm.
something along those lines, where you or some other form of, like, security assessment, purple team, something like that. Like, let's see how something goes wrong. Do we know about it? What could we do about it? Or do a
Mhm.
tabletop exercise, some other form of, like, assessment of your, either the implementation or the process around it, to identify these, like, residual risks. And like, because when
Yeah.
people go through those, like, those more interactive forms of security assessment, I think it pulls them in a little bit more. It's much
Mhm.
more engaging, and the results
Yeah.
are much more visceral. And because of that, it typically, usually, lends itself to the outputs being taken a little bit more seriously and fed into the improvement cycles and backlogs and all of that much more with much more urgency.
Yeah.
Yeah, and that kind of leads us into our next question, just talking about regulations and compliance. So as AI becomes more embedded in healthcare, how do you see the future of threat modeling and regulatory compliance evolving over the next 5 to 10 years?
So
go ahead.
Yeah. So when I was at CMS, I was one of the things that I did prior to leaving is I was involved with this this initiative that the National Security Council had kicked off, where they wanted to do landscape analyses of all of the critical sectors. So I was the lead for healthcare. We did that in partnership with this coordinating council that was like a public-private sector kind of group that came together and worked with them. We put out this report, and that then led to the development of something called the CPGs, the Cybersecurity Performance Goals for HHS. Those then served as, and this was always kind of the long-term plan, was use those and this other kind of complementary framework called HICCUP, which I can't remember what in the world that acronym stands for, but those serve as the foundation for future HIPAA security rule changes. And for anyone who's tracking healthcare regulation stuff like that, there is proposed HIPAA changes out now. Those CPGs and the HICCUP controls are heavily represented in said changes. Now, what that and given that HIPAA hasn't had an update in many years, I would say, like, if assuming this all goes through and becomes law and becomes, you know, the way of things in healthcare, I think it's probably pretty safe to say that this is going to be with us for the next 5 to 10 years. Like, this will be the thing. Now, something that is worth noting in like along those lines is there is a tremendous focus on operation, like system operations and kind of availability, and availability is a key property of systems and environments in the new changes and in the CPGs. And I think threat modeling is an undervalued, underused activity when it comes to like that kind of operational. You think about ransomware, something like ransomware. Like, threat modeling is not the first thing that usually comes to mind. It's like, where's my CrowdStrike? Where's my Sentinel-1? Where's my backups? Where's my this? Where's my that? You don't really think about threat modeling, but I think there's a lot of value in the practice of threat modeling, generally speaking. And I think way more people should be doing some form of threat modeling, even if it's just those show stacks, like 4 questions. And I will shout out Adam Shostak as much as I possibly can, because that man is just the man. He is the dude, the Lebowski, if you will. And so where I was going with that is like ransomware ends up happening and spreading, really any sort of attack, because of the way that environments are designed and then implemented. And it's usually, like, anytime I've been involved in a red team or like led a red team, whatever, uh, there's like the issues usually emerge at the cracks, or like the points of handoff between things. Like, yes, you'll find bugs in a system, but then like it's when things start to, like, it's all those like lateral hops, and you start to, like, the cracks start to emerge at the edges. And that's where I think something like threat modeling really comes into play. And so I see this being a much more prominent, useful activity that should hopefully permeate our discipline, not just AppSec people, but more folks are doing some form of threat modeling in their day-to-day, week-to-week, change management practices. So
Yeah, I like that.
get off my
I like that a
soapbox.
lot. Yeah, you made some very, very valid points. on this topic, I see a couple different, what I'm going to call air quote, major shifts coming based on this 5 to 10 year timeline for the person who asked the question. The first change that I see happening is us going from some of these more generic frameworks to a more like focused AI specific, either threat modeling methodology or framework. For a lot of our customers, we're kind of forcing stride, right, and some of these other traditional approaches to fit the AI use case, and we can at least have the conversation and get the conversation going with some of these methodologies like stride. But I think within 5 years, we'll have healthcare specific frameworks that will address the unique attack vectors from AI, like training data poisoning and model inversion attacks on patient data, et cetera. So the normal frameworks or the existing frameworks today don't do a overly good job of doing that, especially in the context of patient data. The second thing that I see changing is this, I want to say like regulatory cohesion or harmony, right? Because if you think like the FDA has a set of requirements, OCR will have a set of requirements. I'm sure HHS has a set of requirements that may have some overlap across the specific standards or the regulatory bodies. But there still needs to be, even at a high level, these are the standards, these are the bare minimums of your AI system dealing with patient data. This is what it has to follow. So I foresee there being sort of this mesh of a bunch of different frameworks, as well as AI specific frameworks that'll come within the next 5 to 10 years. And last, but I think certainly the most exciting aspect of it is being able to have continuous automated compliance checks versus like the point in time pen test or threat modeling assessments. Because as these AI models continue to learn and evolve and adapt, we'll start seeing some of these runtime monitoring tools that will automatically verify compliance. And it'll save the security engineers, architects, developers a lot more time. So I'm excited to see the next 5 to 10 years. You really can't. It's hard to say, what it'll actually look like because it changes so much and so fast. But those are kind of the areas that I foresee in the next 5 to 10 years. A lot more automated compliance, a lot less human in the loop.
Yeah, the automated compliance is an interesting thing because there's a push in like the federal space, for example. It ends up getting dubbed as continuous authorization, continuous ATO, and the the funny thing about like HIPAA and healthcare regulation is you don't certify against it. Like I see on LinkedIn, people will, they'll post about their HIPAA certification or their SOC 2 certification, stuff like that. And like you don't, like those things they don't exist. You kind of attest to HIPAA, you follow HIPAA, and it's almost like anyone could kind of say that they're HIPAA compliant, and you don't really figure out that and you should be, if you're following it, you're doing things to identify where you may or may not be, where you have gaps, all of that. But nobody else really finds out until either you do some sort of independent assessment or you have something really horrible happen. And then it comes out that you had all these gaps and you didn't have BAAs and you weren't doing a risk assessment and you weren't encrypting your data and you didn't have least privilege and you didn't segment, have separation of duties and all the things. And then you've got huge problems. And that's when like the punitive bodies like OCR get involved. And so I feel like it's the push for like continuous compliance and with the platforms like Vanta, Drata, I think are super exciting. And it's you're doing it to serve yourself really, because in HIPAA you're not really accountable to anybody until something bad happens.
Exactly. Yeah.
And that I think it's just an interesting dynamic versus PCI versus even like an ISO 27001 or other like those aren't regulatory but like compliance standards, controls, frameworks. They're where you do actually have to go through some sort of gate to achieve some sort of accreditation stamp of approval, something like that, to assert that you are or confirm that you are indeed compliant and aligned with the things. And so yeah, not and that's not to discredit that like it's not a good thing to do, because I think it is. I think like moving in that direction of continuous compliance, especially when it comes to healthcare stuff, is a really solid way of having more kind of real-time insight into your risk posture and like your potential exposure, because like the gaps that you may face on the HIPAA front, if they were something that was involved in a breach of some sort of some sort of leak, some sort of incident, then that carries with it non-trivial exposure, be it financial, regulatory scrutiny, all that all that good stuff.
Yeah. That's
Good point. Yep. We've had another question come in. How can regulations support smaller healthcare providers that may lack the resources to implement a robust AI cyber defense strategy?
It's a good question, and it's actually I think it's a really important question too. And actually the link that Stacy put in the chat, the Securing AI, a CISO's Guide to Threat Modeling. So I wrote that blog on the tails of me talking to one of the CISOs that I had mentioned earlier that I DM every now and then. And one of the things that she mentioned is that she didn't think that the regulatory landscape around AI security and healthcare specifically wasn't, in the word she used was well calibrated, was not well calibrated for organizations with resource constraints, right? So not as many headcounts, right? They don't have the budget of a global bank, right? So I think this is really important, because if smaller medical clinics are held to the exact same standards as something like a St. Jude's, right? It's a massive organization. There may be some challenges with that small team in getting to the point where they're as compliant, with FDA or whatever compliance standard they need to be compliant with. It's more difficult for the smaller folks or the ones with the lower budget to actually be able to keep up. So I envision, there may be, somewhat of a dynamic compliance or regulatory framework that, hey, if you're doing this with patient data, then, maybe you need to be a level 3 compliance versus a level 5 or what, I'm just spitballing here, but I envision there being some separate maybe not, what they do with the data or whether or not it's encrypted at rest or in transit, but maybe something that a smaller clinic can say, hey, the patient data that goes through our system is as secure as if it went through something like a St. Jude or some other large healthcare organization. So I foresee something like that happening, but again, I'm basing it purely on the thoughts of a CISO and my own wants and needs. So what do you think, Robert?
Yeah, there actually is, and I'm proactively Googling right now. Trying to find this thing, because there is actually a tiering mechanism already built into the hiccup control set, and I don't know. I'm pretty sure that this has it. Eric Decker would be so proud of me sharing this. The um so yeah, this link has like the link that I just posted into the chat has the full standards and whatnot listed, but effectively what they tried to do, and some of it, not all of it, was taken into the HIPAA proposed changes. Oh, maybe I messed up on, hang on. I'm going to do everyone. Thank you, Jenna. Okay, hopefully that's fixes it. So basically there was 3 tiers broken out for the controls in Hiccup, and that you had like small providers, medium-sized providers, and large providers. And
Mm,
if you're larger, you should be doing more, in
yeah.
part because you're serving more people, you have a higher impact on a, from a critical infrastructure standpoint, and you have,
Mhm.
you're a bigger target, and you have more resources. You should be doing more, and it kind of
Yeah.
scales down accordingly using that same logic. And so I think regulation is kind of embracing that fact, as opposed to just like pushing this one size fits all
Yeah.
um, set of controls on all those who are subject to the regulation. I don't know that it necessarily does it exhaustively or correctly in all
Yeah.
cases, but I think it's a good thing that we're kind of recognizing this
Yeah.
dynamic and moving in that direction.
Nice step in the right direction for sure.
Yeah, for sure. And then there are organizations out there, and even like federally sponsored grants and such, that you can get yourself access, like funding pools that you can get yourself access to if you're in this, if you find yourself in this like healthcare provider space.
Mm,
If you're a commercial organization going and building medical devices or something, or a health tech like SaaS company, and you're trying to like bring something to market, and you're VC backed, like you're not going to get federal funding for that.
right. Yeah.
But if you're a healthcare provider, you're a critical access care rural facility, and you need extra funding, like there are funding sources available, and you can tap into those to get resources for security tooling, security
Yeah.
services, FTEs, stuff like that. And so like those things are out there for that very reason. And as far as like, the question is about it, like including or implementing robust AI cyber defenses. I feel like I would almost go so far as to say we should not, we need to make sure that there's a lot of other basic stuff in place before we start fussing over AI risks.
Mhm.
Like if you don't patch any of your stuff, I
Right.
wouldn't necessarily worry about AI risks. I might, if you don't have MFA turned on anywhere, like, I might start
Yeah.
there.
Yeah. Some
And
basic cybersecurity foundations that need to be in place before you start.
abs-
Yeah.
absolutely, yeah. It's like, like I remember when I was in a buyer role, you'd have people would be reaching out to me about their like post quantum crypto, SBOM verifier zero trust widget, and it's like, yeah, dudes, I got so many other more problems that I have to deal with that like you got to get to the end of the line. Like that's an end of the
Yeah.
line problem. There's stuff that's got to get served before we get
Yeah.
to you.
Yeah.
And of course, like it's 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 good to be thinking about, but you also, like, coming back to threat modeling and your environment and understanding your risks and such, like, you got to make sure like you cover the big things before you cover the small things. And not to
Yeah.
say like AI risks are small, but there's a lot of other stuff that's much easier to wrap your head around, and much easier to move the needle on, and much
Yeah.
easier to like mobilize people around, that are probably more immediate.
Yeah. Yeah, and that's kind of the dilemma with all developers face, right? Hey, developer, I need you to implement this function that secures, our AI systems. Like, well, I got 15 other tickets that are critical, so take a
Yeah.
number.
What about patching that library over there?
Yeah.
That hasn't been, that's like 4 major versions behind. Like, that's
Right.
probably important too.
Yeah.
Yeah,
So
so we all want to know kind of what AI systems do with the data that we put into them. So a question around this would be, how do regulatory bodies verify that these AI systems used in healthcare meet cybersecurity and ethical standards?
I don't know that regulators are really going to get involved in that in a lot of cases. I think if you're talking FDA, like medical device stuff, like things that go through that sort of approval
Mhm.
process, I think that's one thing. But talking about like the standard, um, kind of organization subject to HIPAA that is doing this from a self-attestation, self-assurance standpoint, like there's no regulators knocking on the door unless something bad happens.
Right.
So, I mean, I I can't. I probably shouldn't say that conclusively, but I 9 times out of 10, 99% of the time, like that's like OCR is not proactively going and
Right. Yeah.
rummaging through people's garbage and knocking on their doors, and so um yeah, so I think it depends on like where those regulatory gates may actually live and
Mhm.
if you are subject to actually go through them.
Yeah.
Now, I think I'm going to kind of flip side this a little bit. The If you were building something, like let's say you're building AI tools, like we just started working with a company who is like building a lot of AI tools, and we're working with them doing like a HIPAA risk assessment, gap assessment sort of thing. And basically the way that we're going about it is it's part HIPAA risk assessment, it's part threat model of what it is they're building. And the reason that we structure our HIPAA assessment, like any like compliance assessment like that, is we with like the compliance review and the threat model is from our perspective, especially for an AI tool, the it's one thing to like look at all your practices and policies and all of those things like the people process stuff, and it's another thing to look at the way a piece of technology was designed and implemented and all of that, and like with AI you have all these like other risks around like training and how it's hosted and the development of the actual model or where they got the model and all that stuff. So it has like all this kind of its own little unique supply chain sort of set of dynamics associated with it. And so the so I think in the so I think the onus kind of falls on the product company if they are building something with AI to do that work and figure out how the compliance requirements kind of flow through the way that they're building and what they're building so that they don't find themselves in a tough spot later. But I don't think the regulators are necessarily like the regulators aren't going to force that because the regulators are not checking anything unless something bad happens.
Yeah.
Unless you're
Yeah.
going through the EA process, and that's a different
Yeah.
story.
Yeah, FDA's they take a little bit more of a hands-on approach, especially for medical devices incorporating AI. From what I've seen, and I've helped a few of our clients, because the FDA they require 4 different views, and talking in the context of a threat model. So they require 4 different views for your infrastructure. So you need a network infrastructure, data layer, the hardware infrastructure, et cetera. So there's a little bit more involvement from the FDA side. But yeah, for to Robert's point, most of the regulators they rely on documentation. They don't really have the technical expertise to say yes, that line of code is securing access to this AI system. They're generally looking for just evidence that you've done your due diligence, right? Documented threat assessments, you have security controls in place, right? Security testing, et cetera. Um, I'm not the biggest fan of like the document only verification, right? I think that creates a disconnect where compliance often becomes more about documentation than actual security. And I've been in cybersecurity long enough that I want to try to find the laziest way possible to do something. And if you're telling me you're just looking for a document that says we've done something, that leaves a lot open, for abuse and misuse. So, but I expect this to change over the next few years as regulators and others develop more sophisticated approaches specifically for AI. But as of now, it seems to be a little more hands off, to Robert's point.
Yeah, I mean, but talk about talk about a great opportunity for AI on the compliance side. If you're shoveling more of that documentation creation and documentation review stuff into the purview of the AI models to kind of handle the boring stuff, and you reallocate that time to the more interesting stuff, the technical implementation reviews. I think you identify a lot more real interesting risks in the process. Yeah. That's my 2 cents anyways.
Yeah.
Yep, and let's just shift gears and talk about where threat modeling comes into the picture when it comes to these AI systems, especially in healthcare. So I think Brandon and I both know that threat modeling's required in a lot of these regulated industries. So we work with a lot of customers that have these types of regulations. Where do you see that kind of evolving, Brandon, in your kind of scope of things?
Yeah, well, it definitely, we're still, I'm going to air quote early. We're still early in figuring out how to secure AI, even though it's been around for years, decades actually. We're still as a species trying to figure out this whole thing, how to secure it, et cetera. And in addition, and I empathize with folks coming into cybersecurity in 2025, especially in the threat modeling space. Not only will you have to learn what threat modeling is, how to do it properly, but you're also playing catch up with the skill sets that you need surrounding AI. So it'll be a crawl, walk, run. I think not only from like the personal development side of leveling up your threat modeling skills as well as your AI specific knowledge, but just in the regulatory and compliance area as well. As we find more consistent problems across AIs, more frameworks will pop up to help the world as a whole prevent some of these. So I still have not found an organization that I would consider mature as far as threat modeling and threat modeling AI. But we're getting there. So what are you seeing, Robert, on your side?
We also see a lot of threat modeling and being a core part of especially like the medical device development process. And, that whole kind of pipeline of authorization leading through the FDA is where I think it's most prominent. And I think that is starting to, with the push for like SSDF, secure software development framework and such, starting to kind of trickle across the organization, or trickle across the industry into other parts of healthcare that don't have the same authorization requirements, but are still dealing with healthcare data and all that good stuff. So, I mean, it's moving in the right direction, which is a really good sign.
Yeah, and I know from my point of view, just working with a lot of our partners here at IriusRisk, we're starting to see a lot more demand. I mean, customers are coming in to these partners asking for them to threat model their AI systems and components. So I've seen kind of a lag between the AI standards that are out there today and the technology that's available. It always seems like, we adopt these solutions before we think about securing them. Do you guys have any thoughts on that? I know NIST has, some good ones out right now, the AI risk management framework that we've
Yeah.
incorporated.
Yeah, which I think is solid. It's real solid. Like you're starting to see um these like frameworks. I don't know if I want to call them a framework, but like these like bodies of work pop up that are kind of acting as um guiding lights for those doing this kind of implementation. My hesitation is really kind of baked in the fact that like stuff is moving so fast. Like, I mean, it was not that long ago that like, the first version of ChatGPT came out and everyone was just like, holy crap, this thing's amazing. And now we like, you go back and like look at what was it, GPT-3 or whatever, and
Yeah.
they're like, oh my God, this is what is this amateur hour? Like,
Right.
this is ridiculously JV. And
Right.
and like that was just like what, 2.5 years ago, 3 years ago, something like that, like not
Mhm.
that long ago.
Yeah.
And now we're talking about agents and pipelines and it's just insane how fast things are moving. Like cloud was moving quick, this is
Yeah.
moving real quick.
Yeah.
And so, those kind of standards take time to develop.
Yeah.
And my concern with them is, it's kind of like reading a book versus reading a blog. Like, you can get a blog post out a lot faster than
Yeah.
a book. And it's like, unless it's really truly timeless or, something lasting, then like knowledge that is lasting or has some staying power, then it's going to be out of date super quick.
Mhm.
And I think that's a very real concern in in the AI space right now, is just the speed at which everything is moving.
Yeah. Yeah, and the lack of, or I'll say lack of speed, the caution that a lot of organizations are putting or are using to as they're implementing these AI, that also makes some of the known bodies of work that have already been written. It lengthens the feedback loop, right? Because if I say I'm going to use the NIST AI risk management framework, and by the time I get done with it, and now I have some feedback, things have changed in the industry, and what I did may not no longer be the standard or applicable when it comes to AI security. So yeah, and I definitely see it as an iterative approach, and I'm okay with that, right? I'm okay with a blog going one or two blogs going out for us to kind of test out the framework, and then okay, cool, here's the rest of the document. Kind of iterate, provide the feedback as you kind of make your way through each step. I like that. And I think it's the way to go, especially, to your point, Robert, since things change so fast. Um,
Yeah, for sure. For sure.
Yep. Yeah, good point. Yeah, so let's open it up for Q&A. If you have any remaining questions, feel free to put them in the chat. We do have one on how IriusRisk supports regulation compliance.
That's all you, Brandon.
okay, yeah. Well, if you're all right, Nick, how about I just share my screen and show it real quick?
Sure.
Is that cool? Let's see. Desktop 2. Okay, so this is a simple chatbot threat model that I put together. How IriusRisk can help you, you know, become compliant. There's a couple different ways. One, we can make each of these individual components compliant with something. Specifically, let's say I come in here and say this web UI is going to transmit process PII, right? And so I'll say it's processing PII. Automation kicks off that we got privacy concerns, right? If we're not doing anything with data from the EU, we go on about our day. If we are dealing with data from the EU, more questions need to be answered, and GDPR will automatically be applied. So we can do it here via the questionnaire, answering some questions about what this is actually doing to get our compliance standard, or we can come over to the threats and countermeasures. And over here, we have a full list of standards that we can mark this particular threat model as compliant with. So I didn't go through with that GDPR question. So if I click this, it's saying out of the 695 countermeasures that IriusRisk identified, only 4 of them are needed to be compliant with GDPR. So if I click require, this number here will increment, and now here's my to-do list for compliance. So that's how IriusRisk can help you. You'll generate your diagram, come over to the threats and countermeasures screen here, select a particular standard you want that to be compliant with, and we'll tell you what's required.
Perfect.
Cool.
And then, yeah, just to wrap up, Stacy, do you want to share our resources screen? And thank you everyone for joining us today. We appreciate your time. Robert, Brandon, thank you. It was a great panel.
Of course, it's an honor.
Yeah, there's actually one last question, which I kind of love, in the Q&A. If I may just drop onto that real quick. So, what are some of the positive things it can bring to the industry? So I feel like the amount of like kind of offloading the burden of compliance, yeah, I think it's a huge opportunity, like documentation reviews, documentation generation. There's a lot of really cool work happening around like agentic SOCs and like AI infused uh, security tools, like all really, really cool stuff. And I'm personally really excited to see that kind of continue to grow. Like, for us, like we're a cybersecurity services company, and like we leverage AI pretty heavily in some of our delivery, and it's like it helps us like drive so much more value in the things that we do and keep costs down. So we're not just like throwing 400 people at every engagement that we do. And it's like,
Yeah.
it's been amazing. So like, I think like lots of stuff to think about risk-wise, but lots of opportunity at the same time.
Yeah. I think one of the bigger positivities will be it'll give us as humans some of our most precious resources back, which is time. So I'm looking forward to that, especially around the compliance space. That doesn't change too often. You can hard code a lot of things, requirements in AI when it comes to trying to be compliant with a specific framework. But yeah, I'm most excited about getting some more of my time back. So I'm looking forward to it.
Yeah, indeed.
Good. All right. Well, again, thanks everyone for joining. I just wanted to share, we do have a free training academy at IriusRisk. Jenna will put those in the chat, or Stacy rather. We also have our free community edition. So if you want to get inside of the tool and do some of your own threat models, feel free to sign up for that. And we also have our community, our Threat Modeling Connect, and we do events, all over the US and Europe. So if there's one local to you, feel free to sign up, but definitely check that out. We've got a big TMC event in Barcelona next week and another one later this year in Washington, DC. And with that, we'll close it out, and I appreciate everyone's time today.
Thanks, everyone.